Good evening. Today I read you lecture about the system of the economic relation of healthcare focused of improving the health of the population. Healthcare as corporative system within the social sphere, economic mechanism for managing health resources. What about general concepts of the economic system? Economic relations between people developed through the entire period of human existence. We can say that they were laid back in antique, then people led a joint communal economy. Exchange gradually across which contributed the specialization of labor. For a long time, there was natural exchange, but gradually separate goods emerged, which became a measure of value. At first, these were luxury items or rare things, and then for conventions, coins made of precious metals began to be used, so money appeared. Relation between people developed in relation to housekeeping, which became the definition of economics. Economics literature translates as the rules of management. At the present stage, economic systems are formed at different levels. Each person ends into many economic relations on a daily basis, thereby creation of household system. Enterprises are more complex structure that include a large number of internal subsystems. Their connections are more remote and complex. National economics are also viewed as a system of economic relations covering entire countries. The world economy is the whole complex of economic relations that are developed in relation to the reproduction process throughout the world. It should be noted that all subsystems and elements of any structure are interconnected with each other and have a direct impact for only on each other but also on the state of the system as whole. In the broader sense, the economic system of the state is understood as the whole complex of relations that have developed under the influence of historical factors, including methods, principles, rules, and legislatively enshrined norms for the implementation of economic relations in the process of reproduction. The reproduction process covers all stages of creation, distribution, making the final conception of the economic goods. What about types of economic relation? There are different types of economics. The implementation of economic relation in them depend on the specific features of each individual structure. The classification of their types can be carried out according to following criteria. By the way of management, separate natural and commercial economy, depending on the form of ownership, state, private, or communal. According to principle of coordination of economic activities, central planning, market mechanism, traditions. In connection with the above categories, there are four types of system of economic relation that exist at different historical points in time. This includes the traditional model of economic relations, common administrative, market, and mixed. Traditional economics is many countries have existed for hundreds of years. Certainly, it has served only in remote areas cut off from civilization. Some forms are maintained as cultural and heretical heritage. This model of economic relation is built of traditions and community foundations. The main decisions are made by the body of elders. In such a system, there is a low level of development or complete lack of technology. As the rule, substance, farming, handicrafts, and craft predominate. From the side of governing body, the penetration of new technology and the late trend of the time into established traditional relations is being held back. Trading in this system occurs only then supplies are formed. They completely denies the pursuit of any commercial interest. The main disadvantages of the traditional system of economical relation. It is inertia. Change it are almost impossible due to the strong adherence to traditions as well as full submission to community rules. Common market and mixed system of economic relation. This is economic system. Traditional economy, market economy, common economy, and mixed economy. Economists and anthropologists believe all the economies got their start as traditional economies. What they expect remind traditional economies to evolve into market, command, or mixed economic all the time. What about market economy? Is a system where the law of supply and demand direct the production of goods and service. Common economy. If the central government makes all economic decisions, that the government or a collective own the land and means of production. Mixed economy combines the characteristic of the other system. In a common economy, the state plays the leading role in all economic process. It is believed that the property belongs to the population of the country and the state acts as a legal entity and disposes of all the benefits. He set prices, determined the volumes of production and sale. The state administrative apparatus had the right to intervene in any stage of the reproduction process. Such a system of relation completely denies private property, personal initiative, and desire to satisfy their own needs. The authorities determine their priority area of development, industrial, which finance almost all available funds, and 7. The positive side of such a system is its complete transparency and controllability. It is easy to achieve the planned results in it. But the command system of relation also has a number of shortcomings that characterize its failure. These disadvantages include complete lack of choice. Both the manufacturers and the buyer. A huge heretical system of bureaucratic apparatus, subjectivity of the management, lack of competition, lack of initiative. History has shown that the command economy becomes innate over time, begins to lag behind of development due to its closed nature and inability to develop. The market economy is built on the basic of the market mechanism. It strikes a balance between the total supply from production and the demand generated by buyers. The mechanism is based on competition, which became the engine for the development of the system of relation, makes it flexibility and capable of adapting of new needs of consumers. The characteristic features of market relation can be called freedom of economic entities, variety of forms of ownership, limited role of the state. Most modern national economics adhere to this very principle of building economic relations. The market model allows not only to stabilize a country's economic situation but also to achieve its growth and development. It should be noted that there are practically no poor economic system in the world. Almost every country used all the above models, only their specific weight difference. The traditional economy is preserved in the form of folk arts and crafts. The command economy is often used in industries of strategic importance and defense. Market relations are widespread in the sphere of consumer consumption and service. The system of economic relation in healthcare focused on improving the health of the population. To a certain extent, this state of affair in the healthcare is due to an insufficient level of economic growth. A shortest state to budget fund as well the funds of insurance companies required for its development. At the same time, the widespread commercialization of healthcare has not yet made it possible to use a wide range of sources and resources necessary for its development, including the possibility of solving both intra-industry problems and problems related to the performance of healthcare of its main function in relation of the population, increasing the availability of service, guaranteed this provision to all categories of citizens, ensuring the quality of medical care and establish responsibility for its implementation. For many goods and service in the economy, this model offers a reasonably good description. Yet none of these five features of the standard model reflect the goals on the market for healthcare. Like other markets, the healthcare markets has consumer, patients, and products, doctors and nurses. But various features of this market complicate the analysis of their indicators. In particular, third parties, insurer, governments, and innovating bystanders often have an interest in the healthcare outcomes. Patients often don't know what they need and cannot evaluate the treatments they are getting. Healthcare providers are often paid not by the patient, by the private or government health insurance. The rules established by their insurers more than market prices determine the allocation of resource. In light of the foregoing 4 points, the invisible hand can work its magic, and so the allocation of resource in the healthcare market can end up highly inefficient. What about model of type and market? The prevalence of externalities, difficult of monitoring quality, the insurance market and its imperfection, healthcare as the rights, the rules government in the healthcare marketplace. What about models of typical market? Buyer, buy money, sale, goods or service. Model of healthcare market with insurer, patient, financial rules, insurer, payment rules, provider, assess rules. All-time cycle. How an insurer change a market. In a typical market, shown in panel a seller delivers a goods or service to a buyer who is exchange pays the seller a market determined price. In a healthcare market, shown in panel B, the provider delivers healthcare to the patient, but the provider is paid by an insurer, if the government or in a private company. This arrangement regards rules for financial access and payment. What about special characteristic of the market for healthcare? The standard theory of how markets work is the model of supply and demand, which she studied in our course. That model has several notable features. The main interest parties are the buyers and sellers in the market. Buyers are good judge of that they get from sales. Buyers pay sellers directly for the goods and service being exchanged. Marked price are the primary mechanism for coordination, the decision of the market participant. The individual hand left to its own device leads to an efficient allocation of resources. Against the background of the commercialization of healthcare, the public importance of its sphere as a social branch of the national economy, designed to ensure the improvement of public health. Despite the needs to preserve the principle of free medical care for the category of the population that is poorly social protected and most in need of it. However, the current economic relation, both within the healthcare system itself and the internal environment, in the process of its interaction with the state, call into question the possibility of fully implementation this principle in practice. Economic relation in healthcare, namely the relation of production, creation, distribution, exchange, and consumption of medical goods, have indirect impact not only in the life and health of a particular person, but also in the state and reproduction of such a social resource and potential of society that contributes to the development of prosperity of the nation of the public health. Public health is a medical and social resource and the potential of society of contribution of national security ensure the quality of life due to the state of public health. The most important condition for reproduction of this social resource is the implementation of coordinated state policy implement simultaneously of various sectors of the national economy and sector of the economy in the fields economic growth and social well-being. The healthcare plays a significant role. Therefore, public health depends on the quality of economic relation, both inside and outside the healthcare system, on their orientation towards improving the health of the population. The role of state in the process of regulation of economic relation of healthcare with other sectors and sphere of the national economy, as well as the state and municipal authorities with non-governmental, international, public, and private organizations, should be particularly strengthened. Such a regulatory role of the state has a positive indirect impact on improving public health and will contribute to an increase in the duration and quality life of the population, the well-being of people, the harmonious development of the individual and society. Healthcare is one of the branches of the social sphere of the national economy. Therefore, in the process of its functioning, economical relations should be subordinated, first of all, to the achievement of social goods. The economic costs incurred in this area, but which did not directly or indirectly affect the improvement of social indicators of the function of healthcare, cannot be considered justified. This is due to the fact that by their nature, economic relation, here and the concerns of social relation, reason from meeting the needs of the population in health service, and the indicators characterize that should have a pronounced social connotation. A significant part of social relation in the healthcare system areas in the process of providing medical service to the population, as well as managing them and assume the presence of socioeconomic indicators reflecting the ratio of the level of payment with the quality of medical care and the solvency of the population and so on. In this regard, the development of economic relation in health care should be focused on achieve socio-economic indicators. The economic relation of health care are connected with the problem of rational distribution and use of resources which the help of which the creation of conditions necessary for improving the health of the population in ensued. Then resources are carry an important role should be given to the problem of managing the effectiveness of their use through analyze, planning of the activity of organization in the area development and implementing innovation solution, evaluation the effectiveness of the use of financial planning the activity of organization in the area development the implementation innovation solution evaluation the effectiveness of the use of financial and material resource as well as using various forms of control. Economic relation is healthcare should also extend to resources such as private property, know-how, and the intellectual potential of employers, motivate and stimulating their use by management personnel in solving problems in improving public health. All this necessitate the search and justification of ways to solve an important national economic task. The development of economic relation in healthcare focus on improving the health of the population. Experience of practical activity of medical institution in Russia relates sector of the national economy directly serving healthcare as well as the process of state regulation of its development show the degree of specific elaboration of the problem under study. The study of the process of production, exchange, distribution, and consumption of elements of the system of economic relation in the healthcare. Then interaction between all factors of reproduction in the context of the human health and society. The role of various parts of the healthcare economy on the mobilization, distribution, and rational use of resources. A systematic analysis of the activities of the medical and preventive institution, including sociological and economic analysis of the management on material, labor, financial resources. They tuned out the insufficient development which brought free issue to the rank of topical problems of the theory and practice of the development of the economic relation in healthcare focus on improving the health of the population. Healthcare is a corporate system within the social sphere. Healthcare is a system of organization, social, economic, and medical measure aimed at preserving and improving the health of population. The main resource of a modern organization, this is people, is the preservation and strengthening of the health of personnel based on the formation of a health lifestyle and increasing the availability and quality of medical care that is the key to the formation of consentient and favorable socio-physiological atmosphere. The social policy of organization in the field of healthcare and the elements of the system can be presented, providing free medical care to employees of organization and their family members. Medical measure aimed in protection and resorting the health of employees, prolong their working capacity and professional longevity, annual compensation, target examination, vaccination. Organization of health improvement of employees and members of their families through sanatorium resort and rehabilitation treatment in sanatorium, dispensaries, and other sanatorium resort institutions. A health lifestyle is a prerequisite for development of various aspects of human life. The achievement of activity, longevity, and the full performance of social function for active participant in labor, social, family, household, leisure form of life. The relevance of healthy lifestyle is caused by increase and change in the nature of the loads on the human body due to the complication of public life, an increase in the risk of man-made, environmental, physiological, political, and military nature provocate negative shifts in the state of their health. The World Health Organization pays special attention to assess the negative impact on economic indicators of such behavioral risk factors as smoking, unhealthy diet, low physical activity, overweight, and some other. One of the main problems in modern organization that has a negative impact on the effective work process as smoking, since it is the smoking employer who brings financial losses to his company associated with interrupting the production process during the day as well as due to more frequent sick days. Many Western and Russian companies have been actively fighting for a healthy lifestyle for a long time. Everyone has their own methods, but almost every one of them is applicable at any enterprise. Here are some examples. Sport competition held in the company between teams of non-smoking and smoking employees. Naturally, more smokers show weak results, and as a result, there is a chance that they will think about their future health and leave the bad habit in the past. Prohibition of smoking in the office and the surrounding area during working hours. This measure reduces the number of cigarette smokers per day, which means in improved health. Some smokers are able to stop smoking altogether. Withholding a small part of the salary or bonus. The material factors in any business can work wonder, and even more so in the matter of senseless and harmful smoking. An increase to the annual bonus for each non-smoking employer. Also a great initiative to give up a cigarette. Large and successful firm can award invite specialists to help people quit smoking. There can be various professional doctors and physiologists. As a rule, such programs are designed for several months and gradually bring smokers out of nicotine addiction. Further, it makes sense to monitor their staff with appropriate analysis. Finally, the last and most strengthened methods of combined smoking at the refusal to hear a smoking specialist. Thus, in effect, staff health policy as an integral part of the company's corporate culture. The implementation of this policy within the framework of CSR contributes to the elimination of risk factors that provocate the occurrence of unforeseen economic losses. The essence of this policy is to carry out specific measures for the prevention of various diseases. Finances in healthcare. Money appearance made a condition of finance formation as an independent field of finance and partially production relation. In world economy, finance are determined is a historical category connect with the state and its institution formation. An economic category as a result of goods money economy, part of economic business. A system of economic relation made under formation, distribution, and use of cash resource between state, healthcare system, and commonwealth. The basic of organization, effective regulator and stabilization of economic activity of national economy fields, including healthcare. Process of formation of natural and legal personal incomes and their use. Population is not the only goods or service in the economy that departs from the standard model of supply, demand, and invisible hand. Recall out decision of externalization and monopoly. But healthcare may be the most important goods or service that depart to reductively from the benchmark. Examine the specific features of this market is a good starting point for understanding why the government plays a large role in the provision of the healthcare and why health policy is often complex and within. Healthcare financial relation diagram. Population equal healthcare recipients. Financial resource, medical organization. From medical organization, population weight, health service. Sources of financial healthcare service divide by free, public, private, and international aid. Health system financial. Health system financial is the process of forming takings, accumulation, distribution, a finance used for the satisfaction of the people needs in health promotion and care. Nowadays, the financing of the health care system is provided for common budget profits, fixed dues from the wages funds and population money, voluntary payments and personal money. Depending on forms of organization and the grade of the financial, there are state, national, insurance, and private model of health care system. What about advantages and disadvantages of each system? The advantages of the state medicine, the higher level of the system administration, control of funds, and availability, transparency of the accountability of the system of the population, security of the fair healthcare financing, high quality of the medical care in condition of regal cost. Disadvantages: a deficit of the budget financing, no possibility to choose a doctor, reception hours, quest, labor fluidity, low salaries of medical workers. Insurance medicine advantages: the higher security level of the free medical care, new number of addresses, availability of additional financial sources, a financial investment in field renewal, a free choice of the medical care promoter, a state security in the high quality of the medical care. Disadvantages: huge administrative cost. Private medicine. Advantages of private medicine: concentration of financial resource in the healthcare system, significant investments in the innovation, wide Puchhadar variety, a security of higher medical care quality. Disadvantages, a branch of the social justice in financial and availability of the medical service. The higher cost of medical and pharmaceutical service, significant administrative cost. In the modern world, the global state problem is the health care cost increasing connect with the increase of population, expectation of the higher and valuable medical care quality, the appearance of modern medicine and medical technology. 3 billions were expended for the medical care of the world in. There is a prognosis of the total budget increase in the healthcare minister of different countries to 10 billion in 2020 year annually. And inputs volume of the healthcare could reach 16% of GDP. Income effect of healthcare finances, public and aggregate sources. Health care finance, productive effects, per capita income effects, government revenue effects, and comeback income effects of healthcare finance, or income effects out of pocket private fund resource healthcare finance. That is why Mrs. Ham talking about of different way of the resource for different system of the public health. The relation of the main healthcare purpose, security of the ability and quality of the medical care, defined by the rate and the stability of the field financing. The modern approach of the problem solutions, the additional due from the population, tax or dues on a social insurance, and apportionment of the solvent citizen from groups which have obligatory medical insurance, a search of optimal healthcare financial methods and methods of the labor of remuneration of the medical workers, reducing interaction of the medical establishment and contraction usage when medical service purchase are local authorities. Find the sources of healthcare. Common tax processed, compulsory payment, legislatively approved and forming profitable part of budget, profits, property tax, value added. Fund, a market for a special purpose for compulsory medical insurance, compulsory fixed percentage from an employer and employer wage fund. Premium of private voluntary health insurance, cash resource from private citizen incomes of concerned profit, private cash facilities of population, official and unofficial payment, or sole payment of population given medical service, medical deposit balance, charity payments of social and religion organization. Main characteristic of public health care system. The main financing sources, total tax proceeds, The financing due their distribution by specialized organization, medical establishment financially based in fixed standards, payment fund for medical service, and state and local budget. Medical service, which has the state of regional departments and healthcare and general practitioners fund holders. Main characteristic of Bismarck healthcare model, insurance medicine. The main financial sources are compulsory fixed dues of employers and specific taxes. Medical service. Patch has the independent specialized organization of the United Insurance Fund. State administrative, some elements of compulsory health insurance. Under upper and lower profit margin, labor remuneration, and medical workers as determined by insurance company. Free choice of a doctor and medical institution. Competition between funds and medical service providers. Resource availability for innovation and medical labor promotion. General features of Bismarck-Semashko beverage health care models. Universal protection system, secured medical care regardless of risk. Equal, universal access to medical care. Lack of direct connection between the payment among taxes, dues, and medieval service volume. Compulsory participation of population in discharge of health care costs. State control of pricing. Main characteristic of private health system, financial. A lot of countries all over the world have private system of medical health. For example, in India and in some African country, prevalent private system and financial. The main financial sources, private population finance. Social equilibrium and accessibility principle of medical care are broken. A close connection between individual risk and premium size and medical service volume. Selection between person wishing to get a medical care. Preference to health, young, rich. Higher cost of medical and pharmaceutical service. Direction to specialized and high specialized medical care. Competition between medical establishment and insurance companies. In all situations, the budget is a financial documents reflecting the structure of future profits and expenses in money means and legal form. This is budget organized for all system or all form of public health, private, insurance, or government. Budget is regarded in economics as a legal category, regulate and legislative order. An economic category, constituent of the social economic system. A main link of state finance. Informational, controlling, administrative measure, realize effective regulation of distribute and non-distributive process in society. Secure instrument to balance country development, secure of the optimum correlation between in individual and in social use. Price element. What about price? In each time when we're talking about finance, we first of all thinking, what about price of goods? Price consists of three elements. This is prime cost, required total inputs for medical service industry or its recurrence. Profit, value indicator of activity efficiency, secured innovative activity. And Valorant tax, in indirect tax or customer. That is why price of medical service consists of three parts: cost, profit, and tax. Tariff. This is a complex of insurance rates. Tariff rate, a price of insurance risk and other expenses. And tax, a legally defined compulsory change. Price, money mean of medical service or medical goods cost. Prime cost of medical service, all expenses of a medical establishment necessary for medical service. Profit, a difference between income and expense before tax pay. And very important financial term, this is profitability, an index of efficiency of a medical establishment activity for a fixed time periods. Payment of medical service provides. A payment system of medical service provides as an important operating principle of state government. Realize national distribution of limited resource and making economic motivation of medical works to promote the efficiency and quality of health care. Medical service payment is a process of financial paying for the medical care. A work experience is evidence of the close connection between the financial system of the health care and methods of medical service provides payment. A few methods in countries which insurance system of the health care. A per capita financial with the public medicine. Financial methods. A payment of the first line doctor and organization form of the first aid in order of patient address to specialist. Dependent of time of financial side setting, this medical service provides whether retrospective for given medical service and prospective prepayment payments. The basic payment methods for the first aid are payment for separate service, fee methods, a case-based payment, a payment for a person, a per capita financing or capitation. WHO experts define the leading role in giving the medical aid, a health increasing and strengthening of population, and also in an effective medical resource usage. 9% from 1,000 need hospitalization. 1% in medical service of specialized medical center. Therefore, the following types of capitation have given ground a partial fund holding, a polyclinic of general practitioner, financing for the total size of the activity, planting patient and emergency health, and in total fund holding, a financing for the general size of medical care. The basic method of inpatient medical care payment contain a payment for a bed day amount for a complete case of treatment, a financed by budget, a global budget. The integrate economic model is used the purpose of a fragmentaries overcome in the system of medical care given the financed administrate medical care. The base of the model is integration of the first sector, partial fund holding and payment for an inpatient care by the global budget method, fixed annual budget under agreed efforts. The constituents financial and economic relation in the remuneration of labor system. The following criteria are used in modern condition of an organization and stimulation of a medical staff work. The results on organization activity, structural units, specialists, direct to prospects. The real labor contribution of a medical workers in the results of medical organization activity. The qualification of the medical worker and the ability to improve his professional level. A value of an activity form. Criteria of a post estimation. Payment system of financial side with the medical service provided. Retrospective fee of the moment of after giving of a medical service according resource. Provide defined of medical service types and size and financial side pay for the current out work. Prospective prepayment. A financing side defined and pays for agree with the provider, medical service types and size of the carried out work. Payment for primary health care. Prospective payment by budget. Capitation payment. Retrospective payment for each service fee. Case-based payment. Payment methods for inpatient care. Retrospective bed day payment. Case-based payment by tariff on the base of a clinic, starting group and medical economic standards. Prospective financing by budget, global budget. And what about salary? Very important in the financial system. This is salary of the doctor because this is one of the regulator of the quality of medical health. Salary is a pay in financial means as a rule, paying to worker by the property or an authorized body by employment contract. What about function of salary? Rendering, maintain support, indemnifying, recovery of health loss in result of hand or harmful labor condition. Assessment, determination of labor contribution size correspondingly to the quantity and quality of the complete work. Distributive, determination of property find resource. Promoting to improve intensity and activity efficiency. Salary, basic, traffic rate, staff salary, tariff rate, staff salary, bonus, promoting nature fees, additional payment, compensation of additional labor cost connect with the working regime and condition, and additional and income side depend in achieved outcomes. Payment form and methods of medical workers' labor. Payment by the hours. Take into account working hours and salary. Simple payment the hours. Premium payment by hours. Payment by results. Take into account the quantity and level of the complete work. Direct, result progressive, indirect, results premium, acute results collective. An analytic labor assessment includes multi-factor payment process and is based in the application of the individual salary. And else questions which I want to discuss today is the main ways to improve the quality of health care. Participants some social determinants of health. This is economic stability, social and community contents, built environment, healthcare access and quality, education access and quality. And all this determination connect by quality of healthcare. Improving healthcare quality can be viewed on both a macro and micro level. It's something that will require sweeping systemic change of the entire healthcare system as something that individual physician can practice for each patient. For instance, the healthcare industry could dramatically improve healthcare quality by institute great transparency and require practitioners to use patients certain that they readily accessibility to all care provides and patients themselves. By the same token, physicians can improve healthcare quality for their patient by following protocol to keep patients safe from infection, following up more regular and connecting their patient to better resource. Primary care providers are actually best positioned to impact the quality of care in the source. Then use correctly, primary care providers can act of the hub for patient-centered care. Primary care physicians tend to be more connected to their patient and better able to understand the individual patient's needs and health journey. Five-step primary care providers can take right now to improve quality health care for their patient. Collect data and analyze patient outcomes. First of all, the first step of improving the quality of care of organization is to analyze your existing data of understand their opportunities exist. Analyze patient population, organization, operation to identify areas of improvement. Then use this data to establish as baseline for patient outcomes. Ideally, the wealth of ability data and IT-based system of to enable more patient-centered connect care. While electronic health records were supposed a full file with promise of more patient-centered care and reality most focus in documentation, better billing, and increased revenue. Organization wants to improve quality healthcare with the place to start. Be as rigorous about the tracking patient wellness as you are about tracking billing. The electronic health recorders outcome studies, patient satisfaction survey, and other data sources to closely monitor the health outcomes, overall wellness, and cost for individual patient across the entire continuum of care. Set goal and commit to ongoing evolution. Once analyze patient population data to understand their risk and study practice operation to identify area for improvements. It's time to prioritize and this area and set goals. Whereas several health organizations with established quality and consistency measure that could guide your goal setting process. The quality payment program, the National Quality Forum, and the Agency for Health Resource and Quality of published evidence-based guidelines and measures. Improving quality healthcare isn't a one-time set it and forget it even. It is the evolving process. The key to acceleration any quality improvement process as known as the plan, do, study, act cycle. First you plan a change, then you enact the change, then you observe and analyze the results, and finally you act on that you've learned. This model was developed by the Associate of Process Improvement as a powerful tool for improved quality in clinical setting. Improve access to care. Having access to care is the single most important factor for improving quality health care and patient outcomes. Patients must have access to the right care of the right time in order to get the right results. Unfortunately, close the 15% of population in still ensure that dramatically reduce their patient access to timely care makes them the go without preventive or primary care and force them to really in higher cost and lower value service. Focus on patient engagement. Patients can be the best advocates for their own health. But first, they have to engage and touch to the proactive healthcare consumer. This is not an easy task, but it is one of the primary care providers and particular well prepared to undertake it. Primary care physicians are better set up to the patient entire healthcare journey than medical professionals who work to hospitals, specialized care centers, or urgent care facilities. Primary care physicians are in a powerful position when it comes to overall quality of care. They are able to act on the glue that holds all the different aspects of care together and support the patient through the entire care continuum. Patient engagement should not stop the patient, however. For true engagement in healthcare, primary care providers should think more holistically and find effective ways to connect and encourage communication between families, physicians, other care providers, insurance providers, and social service through the patient entire healthcare journey. And connect and collaborate with other organizations. This is very important. Finally, healthcare organizations that truly want to improve their quality of care should regularly research and learn from the other organizations, both in their own region and across the country. Go back the area for the improvement you identified and goals that you set and look for the other healthcare organizations that excel in their area. To find these organizations keep your ear to the ground about healthcare, facilitate that they experiencing success in certain area, attend conference, read and literature and research online. Next, reach out the organization you identify and find out that you can learn from them. Most organizations are happy to share to improve the lives of all patients. In addition to implementation change at your own practice, you may find healthcare organization you can partner with the improve patient outcomes. Patients today are less limited by geography and other benefit from opinion of their care option for major procedure. Even for day-to-day care, the routine procedure that you typically handle in-house. Primary care provides an equally position to connect patient to additional service that will increase their success, proactively following up on care plan, and judge patient across to continue of care and close the communication loop with other healthcare organizations. In other words, primary care providers are best able to take responsibility for individual patient both inside and outside clinic wells. Many development economic are at risk for being hit hard by dual health and economic shock, with forecasts suggesting a cost of up to 8% in global GDP in 2020. Yet that is less well known. If the chronic economic drag from poor health each year about 50% lower GDP from premature death and lost productive. For example, in low-income country, infection, disease such as tuberculosis present the largest losses to labor supply and household income. This means that globally, of the estimated 60 million deaths in 2020, 25 million people will be died before they reach their 65th birthday. While development countries have made significant progress in the last 2 decades in improving health outcomes, they still lag significantly behind high-income countries. If we were to better use no interpretation of more aspirational yet realistic rates of adoption, the economic payoff could be substantial. The economic return of between 2 4 across development countries for every $1 invested in health. In these pictures, you check how if you for each dollars invest in the providing health, an economic return of 2 or 4 is possible. This is upper middle country, lower middle country, and low income country. Welfare impact upper 41, lower middle country 54, and low income countries 16.4. GDP boost 7%, 6%, 11%. GDP very important for keeping of the health of people in different countries. This is prognosis of United State company. Prevention is better than cure, and about 3/4 of the untapped opportunity to improve health occurrence from preventive measures such as vaccination, better nutrition, and broader access to care for infection and other treatable conditions. More than half of the total health improvement opportunity identified of lower middle income country could be delivered through intervention with incremental cost of less than $100 per year of health life guaranteed. In upper middle income country, in turn, prevention of the cardiovascular disease with polypill and supported behavioral change could be the highest impact intervention to improve health delivery at the relative low incremental cost, making health a priority and showing focus to area that the highest return can improve resilience, reduce health inequality, and promote great individual, social, and economic well-being. Thank you for your attention. Goodbye.